A COVID vaccine's been approved by the FDA, yet many people are still unsure about whether they actually want it. So how are doctors handling that conversation? Dr. Nicholas Testa is the Chief Medical Officer with Dignity Health Southern California, joins us now to talk about it. First off, Dr. Testa, good to see you again.
Good to see you, Phil.
So despite the fact a lot of people said they were waiting for FDA approval to get the vaccine, that's happened now. And yet many people still hesitant. What do you tell them? How do you have that conversation?
So what I tell my patients is that the vaccine was fast-tracked, which is what we wanted to happen. That does not mean safety steps were skipped. It just means that a lot of the bureaucracy that the FDA would typically have to go through was skipped. And then what was also, it was prioritized ahead of other projects. So I think that's an important thing to remember. In addition, I think something that people tend to forget is the development of an mRNA vaccine was much quicker than any other vaccine that we've ever seen because of the science behind how we develop mRNA vaccines. And that was a huge advantage to this process. So I don't see that any safety steps were skipped through this process.
So I look at this anecdotally. You're going to a movie. You still have to buy a ticket. You're just getting to cut in front of the line. That's oversimplification?
Definitely one way. That's a very good way to look at it, Phil.
Okay. Now, we know the Delta variant. Are there other variants out there that we should be watching out for?
Yeah, so the Delta variant right now is the main variant of concern, right? So it's making up 98% of what we're seeing in the United States. There are what we have as called variants of interest, and there's about 4 of them out there. The one that has sort of jumped to the top of the list is the Lambda variant, which started in Chile and has been predominant in Chile. It looks to be as contagious, but what's concerning is we haven't determined if the vaccine is as efficacious with it. Now, I will tell you, while it's out there, we've only seen about 1,000 to 2,000 cases in the U.S., so it hasn't moved into that area of being a variant of concern. It's still just of interest.
And of interest, when you say the vaccine itself, if you could explain this it's more easily adjustable, maybe, than some of the vaccines we've seen in the past, right? So as variants come along, we can go into the lab and adjust the vaccine. Is that correct?
Yeah, you're spot on. Similar to the previous question, we were able to develop the mRNA vaccine much more quickly. We are also able to make those slight genetic modifications more quickly, too.
Okay. Also, kids back in school. We've seen that, and there are also cases among younger age groups. We saw a pod of students at one of our local schools need to go home. What are you thinking about the younger age groups now?
So what we've seen in the last month is a 4-fold increase in pediatric patients with COVID, which obviously gives us all pause. Now, part of that may be just because across society, we are seeing an increase in COVID cases right now. But as kids go back to school, and with our 12 and under being unvaccinated, they're clearly a vulnerable population. But what I have to say is that social distancing measures work. And so we really need to lean into those in our school-age children. So mask mandates and testing all need to stay part of what we're doing to protect our kids because they are really at risk.
Okay, Dr. Testa, thank you. And I can tell you, for a child that is under the group right now, mine, she actually asked the other day, when can I get the vaccine? So maybe we should, out of the mouths of babes, maybe we should start listening to our children.
Hopefully sooner than later.
Okay, thanks much, Dr. Nicholas
Take
Testa,
care, Phil.
Chief Medical Officer with Dignity Health Southern California. Thanks again.